Health News is brought to you by Dynamic Physical Therapy. Call us today to set up a free 15-minute screening with a physical therapist.
Many people who seek physical therapy do so with the hope to finally put an end to pain that just doesn't seem to go away. This relentless pain, known as chronic pain, can be constant or intermittent, but it never goes away for good.
A lot of patients will come into therapy, a lot of times it's with low back pain, or they've been dealing with knee pain for a long time, or neck pain for a long time, and it's been going on and on. They've tried therapy before, they've tried medication, maybe injections, different things. They've been to pain clinics, sometimes they have, sometimes they haven't, and they haven't really found anything that's really helped them.
Chronic pain can open sufferers up to a spectrum of other problems such as financial struggles, relationship troubles, and issues at work. Many even become depressed and begin to believe that chronic pain is a permanent leech on their life.
And so they usually come in pretty frustrated, don't think anything's going to help. And the one thing I tell them is that, coming into therapy, our job is to be kind of a problem solver, put the puzzle pieces together, and really work at seeing, okay, what can we do to make a difference?
Many sufferers of chronic pain feel they have done all they can do to fix the problem, from medications to injections. Some have sought physical therapy previously, and nothing's helped. Physical therapist Terry Hamp from Dynamic Physical Therapy urges long-term pain sufferers to not give up.
The first thing I ask is what they've done before. And if they've had therapy before, I say, okay, don't count me out yet, because I'm not going to do what anybody else has done before. That's not going to help you. And they've gone to therapy, they've done the same thing 2 or 3 times, and nothing's helped. Well, then I'm not going to do those 2 or 3 things again that they've done before. I'm going to look outside the box.
Hamp says it's important to remain optimistic, but it's also important to be realistic and patient with the healing process.
It's a slow process that they have to realize too, that it's not going to be an overnight fix. And so I really try to educate the patient to say, okay, it's a step-by-step process. Hang in there with me, give me a lot of feedback, and work with us, and we'll have to keep modifying and changing to make sure we find the right approach.
Physical therapy can be a tremendous undertaking, causing many patients to give up or never try at all.
It's a matter of step by step working together and developing that trust so that we can start to make those changes. And it takes a lot of consistency and persistence, and frequency to come in to set that stage. So it takes a lot from that patient, and I ask a lot. But in the end, usually we get some really good results to get those people feeling better and being able to lead more normal lives or go back to those patterns that they wanted to.
Chronic pain can be exhaustive, causing sufferers to become discouraged and think they need to come to terms with the pain, but that should never have to be the case.
The one thing I would say is I tell people, don't give up hope. Don't write yourself off. If your function is decreased, you can't work, you can't be active, you can increase your activity again. You just have to do it slowly, you have to do it smartly, have your physicians help, have a help of a physical therapist so that they can work through all the issues that will come about. It's not that, okay, this is where I'm always going to be, I'm not going to be able to do these things. No, there is, and it takes time, and it takes persistence, and, just hammering at it slowly over time. And that's where my job comes as a cheerleader to say, okay, one step at a time, hang with me. It takes 2 or 3 or 4 weeks to start to see some change, but you hang with me, and we're going to make some progress.
With My News 26, I'm Kayla Kiley.